grandmother were alive today, it would take her 9 months to get an appointment to see me, given the wait list. And if she did, she couldn't afford me. The impact I wanted to have, I was never going to have that impact seeing one patient at a time in a system that was really geared around very privileged access and actually not helping people get better. We're going to embark on the largest population health study that will collect cognitive and brain health data digitally from individuals on a large scale to create a patient registry that will enable better understanding of the underlying pathology that leads to Alzheimer's disease and better drug development.